Sorry, just pulling it up. Screen.
Doing this every week, Lisa.
No, of course, absolutely. I did want to introduce Candace. She's sitting here beside me. She's our new medical student who is here from Rocky Vista. She is the March person. So everyone, please welcome her and thank you. All right. So reported cases in Colorado. Can everyone see that? Okay.
Yep.
Yes.
Awesome. I have plateaued, and we've all been hearing in the news and reading that the cases have certainly come down from the holiday surge, but they are still higher than they were this summer. And so, if you look at our two previous surges here in Colorado, about 1,000 cases per day maximum initially in the last spring and then in the summer. And if you can see here, we are still well above that. So although certainly better than we were in December, we are not out of the woods yet. If you look at positivity rates, they all have also plateaued. And so although less people are getting tests overall, there's still a consistent percentage of them that are positive. So COVID is alive and well in Colorado. Our incident rate has decreased, and thank goodness Lake County is finally out of the dark color. Yay! That's the first time that we've seen that yet. So what that means is that we are now in the high instead of the very high level, and we have somewhere between 50 and 100 positive cases per 100,000 people. So better, but still obviously not out of the woods yet. Hospitalizations have also plateaued. As you can expect, if the numbers of cases continue to be about the same, the hospitalizations will be about the same. But still good news, obviously nowhere near capacity, and we continue to be able to take care of our own here at St. Vincent Health. Deaths among cases have decreased also. We can expect that this number, however, to plateau like everything else. And so obviously the message is very consistent that we're certainly better than we were in December. My gosh, look at that. However, we are definitely not out of the woods yet. Our local data continues to mirror what happens at the state. And so we have also had a decrease in overall cases. And you can see there are little spaces here where we've actually had days with no cases. Yay! That actually hasn't happened since last year. So, there are a few days here where there are no cases reported in Lake County, which of course is awesome. Our positivity rate has continued to decline. We'll see what happens this week, but it appears as though two things have happened. Less people are getting tests, and less people, the people who are getting tests, less of them are positive. So, still I would encourage folks to come in and get tested. It does help us with our data collection. But certainly if anybody is sick or has exposure, please make sure that you're consistently getting tested as you had in the past. Our curve is flat. So awesome. I love flat curves. It's great news that we are having an overall decrease in our cases. And hospitalizations have also tapered off. We haven't had a COVID positive patient here in our hospital in almost 2 weeks, which is good news, meaning people are obviously still getting infected, but not sick enough to be hospitalized. And our overall number looks, it's coming down, 28 positive cases recently over the past 2 weeks. Remember that, the denominator was 400, at one time when we did our peak of testing. So when the denominator goes down, also the equation changes as well. So keeping in mind that we still need to test is important so that we understand, where the virus is and of course, who we need to quarantine. And the positivity rate in Colorado is plateaued at about 3.42%. Um, and of course, we all know this. So let's just talk just a little bit about the vaccination efforts. And I think, I know I keep saying this, but next week we're going to start putting vaccination data in here. But Lake County continues to soar well above our compadres in central Colorado. And it is we've been vaccinating a lot of folks, so well over 1,000 vaccines now to people in our community, which is great. On Friday, the 5th, we start our next phase, folks over 60 and those who have 2 medical conditions, anybody over age 18. The rollout will look like this. I'm obviously subject to change, but all the people who are 60 plus will be called, similarly to all the people who were 65 plus and 70 plus. They'll be called and they'll be scheduled. Those who have medical conditions, they are encouraged to contact their provider. Either St. Vincent Health or Rocky Mountain Family Practice. They can also go online to safewaynow.com and find the same information. But there is a form that delineates what 2 medical conditions are. And Josh, I don't know if you have that list of medical conditions that you might share with the group. If not, I'll put it in the chat here in a little bit. But it is essentially 10 conditions that qualify you for the vaccine. And so if you, after reading that, you believe that you qualify for the vaccine, you're encouraged to call your provider. Your provider will either email, snail mail, or you can come in and pick up the form. And if you click 2 boxes, meaning that you have 2 medical conditions, and you return that to your provider, they will then call and schedule you for your vaccine. And that is how we're going to do it, knowing that the Public Health Department, St. Vincent Health, and Rocky Mountain Family Practice has the Moderna vaccine. Safeway now has the Pfizer vaccine, and so they'll do that similarly because of obviously the constraints with how this vaccine is administered. On the Colorado website today, I have the availability to order the new J&J vaccine, which is a game changer. The J&J vaccine, as we all know, is just like the flu vaccination. It can sit in your refrigerator for months. It's a multi-dose vial. It doesn't have to be all used up all at once. And for the vaccine distribution, and it's only 1 shot. Vaccine distribution is huge. And so hopefully we'll be fortunate enough to get some of the J&J vaccine where we can start vaccinating other folks. I will encourage everyone to read about the J&J vaccine. Please know that although it doesn't have the 95% efficacy rate, 100% of the time it kept people from dying and it kept people out of the hospital, and that's huge. Thanks, Karen, for posting that. I appreciate it. It's huge. And so you have to remember that most years the flu vaccine, we're happy when it's 50% efficacy. And that's enough to keep people from dying and keeping people out of the hospital. And so that we can have a 78% efficacy for something, and 100% of the time no one was sick enough, obviously, to be in the hospital or pass away. It's fantastic. And so please don't feel as though that the J&J vaccine is less of a vaccine. In many ways, it is more of a vaccine because of its ease of administration. But we will keep you posted. Hopefully we will know when we get our first shipments. And of course, I will let everybody know through this venue.
All right. Any questions for Dr. Lisa? Well, as usual, thank you very much for your